public enemy, and this is alcohol. Okay? Now, you could have noticed that alcohol, the benefits of alcohol are exaggerated by advertisements. Is it true that people become happy after they have drunk? Maybe, but how long is that happiness? Okay? Can we say it's lasting? So, advertisements and billboards exaggerate the feeling that you get after you drink alcohol. Now, the intention of these ads is to promote their product. They have no interest of your health in mind. So they want to put the commercials in such a way that you can be attracted to them. Even those people who manufacture alcohol, you'll be surprised to realize themselves they're very keen when it comes to taking of alcohol. They are either they are moderate or they do not take alcohol at all. Niliwaambia siku moja ya kwamba the owner of Keroche, anaitwaje? Tabitha Karanja, alikuwa anahojiwa na Chachi. Okay? So akaulizwa, would you like to marry off your daughter to your best customer? The best Keroche customer. Who is the best Keroche customer? Yeah, a daily drinking officer. Okay? So would you like to marry off your daughter to your best customer? And then she was reluctant to do what? To answer. Because she does not want to lose the customer. Neither does she want her daughter to be married by somebody who drinks daily. Tuko pamoja. So that is how they regard you. If you're a person who drinks on a daily basis, no one can trust you with their daughter. And no one can trust you with their job. Now, as I said last time, so many people have lost their lives because of alcoholism. Some, as we talk, they are dead in the mortuary. And I said, I want you to count how many minutes we have spent since we started this session. In the last 30 minutes, because every 60 seconds, 1 minute, somebody is dying of alcoholism. Okay? And the statistics are so huge because we are losing up to 3.3 million people in the world every year because of alcoholism. Okay? So it's a misleading substance. One, because it's legalized. Number two, highly advertised. And then it is generally accepted by all age groups. So alcohol kills 5 times more people, causes 5 times more diseases, wastes 5 times more money than any other drug. It also destroys families, especially where the husband and the wife are drinking. So if you have a family where the husband and the wife are drinking, what do you expect of the children? Na niwaulize, huwa mnajali watoto wenu? Unapokunywa pombe, huwa unajiuliza ungependa mtoto wako awe anakunywa pombe? Because children may listen to what you say. You might tell your child, please don't drink alcohol. So they listen. But when it comes to practicing, they practice what you practice. Kwa hivyo huwezi ukaambia mtoto usikunywe pombe na wewe unafanya nini? Labda atasikia, lakini atafanya nini? Atafanya kile huo unafanya. Na kwa sababu children trust you. In fact, they treat you as gods or idols. So they think whatever you are doing is the best thing for a human being to do. Okay. So we have said that it is the most destructive of all drugs. And these are some of the causes of deaths that come as a result of alcohol. Accidents by drivers who drive under the influence. And I'm not sure why. The drivers always have confidence. Once you have drunk alcohol, you have the confidence to drive on the road. Nashangaa huu ujasiri unatoka wapi? Because alcohol will give you wrong judgment. Mtaro ambao mtu wa kawaida hataweza kuruka, mtu amekunywa pombe anafikiria huu mtaro nitaruka. Kwa hivyo akienda kuruka, what happens? Anaingia kwa mtaro. Mnakuta jamaa asubuhi kwa mtaro. Labda ameumia mguu ama amepata fracture. And because alcohol is a painkiller, okay? You know, once you get injured, you're supposed to have pain. And the pain is supposed to give you an assessment of how much damage you could have suffered. It is not so with alcohol. It is going to depress your pain. And what might happen, you can bleed a lot and die. Because your body was not able to give you the signals. You had depressed the signals. So this is how you put yourself into danger because of taking alcohol. So, sir, and we've seen many people die in road accidents because of loss of judgment. Now, consider home and work related accidents. So mtu ni carpenter na amekunywa pombe and they still want to insist they will work. So unakata kwa msumeno alafu umefanya nini? And some of the machines you use, you know, they are electric. Nishaiona mtu amekuja amekatwa mkono na kitu inaitwa chaff cutter. Si mnajua hii mashine ya kukatia nini? Ng'ombe. Imagine, na anajiambia amebeba ka mkono, amekuja nako kwa hospitali na mkono huu. Ingine imekatiwa hapa. So ananiambia hata daktari nimebeba hii nyingine. Uone vile? So you misjudge the danger facing. Kwa sababu ya nini? Pombe. So we are working with what we call hazardous instruments that can easily cause injury and death to you. You've taken alcohol and you still insist on going on with work. So kuna wale wanatumia what we call an eye opener. So before they start their work, they have to kutoa lock, si ndio? Ili waweze kufanya kazi. Now the problem is, eye opener should not be. Are you able to decide how much you need to take when you go for an eye opener? Wale ambao wametumia pombe wanaweza tuambie. How much is an eye opener? I mean, how much do you drink to say this is the eye opener? Ama unaweza jipata umeenda kuchukua eye opener and you end up drinking excessively. Are you likely to be tempted to drink more than the eye opener? Exactly. Okay? And when you have drunk excess and you think you needed to take it in order to be able to start the work, then you miss to attend job. Okay? And this is the way people have lost very good jobs, and their jobs have being taken by other people who are sober. So people are losing jobs, they are losing families, they are losing social contacts because of these alcoholic behaviors. Okay. Now, we've talked of impaired judgment, increased accidents, and something else worth noting is the crime rate. The crime rates. So, do you agree that people who take alcohol are also involved in crime? At least this one I can say for sure, because I've also conducted ministries in the prisons. And all those people whom I have interacted with, who have been convicted of certain crimes, they also confess to abuse of alcohol. In fact, some say that were it not for the alcohol, they could not have gone to that extent of even murdering someone. So someone would like to engage into a serious crime, and they know their conscience also betrays them. And the only thing they use in order to commit that crime is alcohol. So drug abuse and crime, they are cousins or they are sisters. Exactly. If you go to areas where we have high crime rates, for example, in the slums, you will also find people there also abuse alcohol. Okay? Wewe umehusika katika ujambazi. Kuna mtu amehusika ujambazi hapa? Kuna mtu ashaishikwa na polisi hapa? Ha? Ama nauliza a very obvious question. Ha? Ha? So, when you're in the police cells, do you enjoy that kind of climate? The police cells. Some will say they are used to it, and therefore it's no big deal. In fact, some, when they are arrested, they say they make good money when they go to the cells. Kwa sababu hao ndio wanaajiriwa na polisi kudiscipline. Watu kama huyu jamaa alikuwa anaitwaje? Huyu aliuliwa kule Nairobi. Ojwang. Albert Ojwang. Hamkusikia? Huh? Was he killed by the inmates? Ama he was killed by police? Ama police hired those who are in the cells to kill? Huwa mnafikiriaje? Ama we ulifikisha hiyo story wapi? Nani aliua Albert Ojwang? Huh? Directly ama walitumia mtu mwingine? Walitumia the inmates, Oh, okay. Yeah. So these inmates, they have to be under influence to be able to commit such a crime. So, were the inmates arrested? They were not. Why? That's cover up, Okay. So how does alcohol affect the body? Let me pose a question. Do you believe that alcohol use is injurious to the body? It damages your body. Now, when you're drinking alcohol, huwa unafanya hesabu hizo ya kwamba unaweza ukapoteza viungo fulani vya mwili, ama we unaona tu enjoyment? In fact, alcohol is harmful to the body. It damages body organs. And we'll discuss some of these organs that are damaged. I have not interacted with different brands of alcohol. Now, do they put labels to show that alcohol is dangerous the way they do on cigarettes? Huwa wanaweka ya kwamba this brand can cause liver disease, kidney disease. Do they put those labels? Huh? Oh, they talk of excessive consumption. So what do you understand by excessive consumption? Huh? Because even when the label is written, you end up drinking excessive. Okay? Now, remember, this is a drug. Okay? Everybody starts low. You start by taking a small amount. So, the label excessive alcohol is also misleading because once you attain certain levels of pleasure, you always want to have more. Okay? And having more is what we call excessive. In fact, if you have a craving for alcohol, you are already drinking too much. Right. Do you have people who drink little amounts of alcohol? Where are they? Huh? They're at home, eh? So if you're here, you must have drinking. You must be drinking a lot of alcohol, isn't it? So are you saying that there are people who can live, who can use only 2 beers and they're comfortable with that? Oh, okay. Without having craving for more? Okay. So we'll be looking at ways in which alcohol affects your body. And the first effect of alcohol on your body is your mind. Okay? Your mind. It gives you a false perception of life. So it tells you that life has only one phase, and that is happiness, which is not true. The reality is life has ups and downs, and if it has ups and downs, it's the high time we realized that we need to face up to these ups and downs in equal measure. So there are times when you have to go to the garden and cultivate, and rain does not come. So you lose the seed in the field. So that does not mean you're not going to plant again. So you continue planting because you have hope. You know, the problem of alcohol is that it tends to mask for a short time the reality. But once the alcohol wears off, you go back to the same reality. So if you needed to pay some school fees for your kids, definitely you have to look for those school fees. So that is the reality of life. If there's food missing at home and you're needed to provide, escapism or taking alcohol to run away from that reality does not provide that food. So you still have to provide the food after the alcohol wears off. So the reality is life has ups and downs. Now, the other effect of alcohol, and this is important for you to know, it damages your stomach. Now, you've ever heard of stomach ulcers, vidonda vya tumbo? They're also called peptic ulcers. So it damages the inner lining of your stomach. Okay? And once you damage that mucus layer that protects you from interacting with the acid in the stomach, you have what we call inflammation of that wall, And continuous taking of alcohol will lead to erosion of that wall to the extent that you can even form an ulcer, to the extent that you can even perforate your stomach. And people have come, alcoholic people have come to hospital admitted with severe pain as a result of that perforation. Most of them do not survive. And why they do not survive is because you present to a hospital that does not have a theater, and that is an emergency case. So by the time they are looking for a hospital to refer you to, and the process of preparing you for theater, they die. Any perforation in the digestive system can cause death in only 6 hours. Okay? And the problem of taking alcohol is during the process or during the time of taking alcohol, it depresses that pain, just covers up the pain. Normally, you're supposed to respond, you're supposed to have pain, and you need to feel it if you're not taking alcohol. Lakini kwa sababu alcohol ni painkiller, you don't feel the pain. So you go all the way to perforation of your intestines or your stomach. And then by the time you're brought to hospital, it's too late. And some die. It's unfortunate. Now, alcohol will also damage the liver. It will damage the liver. Either it can cause tumors like these ones, okay? And they start small, and then you can end up having very big tumors or causing a disease we call liver cirrhosis. This is the kind of liver we find in most alcoholic patients. It's called a fatty liver. It's called a fatty liver. It has a lot of fat. Alcohol deposits a lot of fat in the liver. So these patients will come with yellowness of the eyes, okay? They are not able to break down the alcohol anymore. So anytime you drink alcohol, you get drunk very fast, okay? Because it is the liver that reduces to what extent you'll be drunk. Unaposikia kwamba watu wanasema ninakunywa pombe chupa ngapi na silewi, ni kwa sababu maini yao inawasaidia kufanya nini? To break down part of the alcohol. That is why you do not get drunk fast, okay? But once you damage your liver, you start getting drunk faster and faster. So when you still have your liver functioning, you can drink a lot. But once you damage it, okay, you'll be getting drunk very fast, and that is not a good sign. It might mean that your liver is damaged. Now, this is what we call cirrhosis, and cirrhosis of the liver simply means that you no longer have a liver. It's like a liver that does not have blood circulation. So the liver must have a lot of blood vessels to help you in circulation and passage of blood from other organs to other organs. But when you have a liver that is congested, it does not have any indication it has a blood vessel, then we say it is liver cirrhosis. The other name for this is end-stage liver disease. So if you've ever heard of stage 4 liver disease, this is it, okay? So at this juncture, you have lost 85% of your liver. And because it's difficult to get a liver transplant, these people will end up dying, okay? Now, the problem with the liver is most people do not know whether they have a liver problem until you have lost more than 80% of your liver. And that is why it will be important for us to be taking what we call liver function tests. Unapimiwa maini kuangalia kama unafanya nini. Ili tukiona ya kwamba the tests we are looking for are high, we ask you to stop. Na wengine hata baada ya kuambia unaona maini yako unaharibu, hawajui hiyo ni kumaanisha nini, because they can't feel the pain. They want to wait for the more than 80% damage for them to realize ya kwamba they have a problem. Okay. I do not want to ask this question because some of you have confessed, and this is true. We have to admit first that we have a drinking problem, yeah? Because denial is not going to help us. In fact, I need to thank all of you who have voluntarily agreed to be here, because that is a starting point of reforming your life. Okay? And we are looking forward to better times. In fact, after you're done with this rehab period, I'm looking forward to seeing you starting investing. Whatever time you wasted, whatever money you wasted, whatever energy you wasted, please redeploy that energy, time and money for a very good investment or project that you can remember. Okay? Kwa hivyo hesabu siku zinavyoendelea. Wengine, kuna mtu amebakisha mwezi mmoja or less. Wow, kunao. Okay? Kwa hivyo tafadhali wacha tukubaliane hivi. Huo mwezi ukiisha, sawa sawa, we want to hear you somewhere ya kwamba umeanzisha projects because you have a lot of energy. In fact, the energy you wasted in alcohol, it's a lot. So convert it to a project or something that people can remember you for. Go and take care of your families. Ensure that your families are happy that you've come from a rehab and you have been reformed. Hiyo ndio kitu ya maana. Wale wameanza, please use these 90 days to gather knowledge. If you need to understand certain things that are not clear here, be willing to come forward and let's discuss. Because we do not want to waste any more energy, we don't want to waste any more money, and we don't want to waste any more time. Time is so precious. Kwani mko na miaka ngapi ya kuishi? Ikienda sana. Do you know the lifespan of Kenyans is 50 to 60 years? That's the average. So kumaanisha watu wengi wanakufa kati ya 50 and 60 years. So if I hear somebody is wasting 10 years in alcohol, I'm wondering, where are you getting all this time? Okay? Okay. Yeah, we've talked about work and how we could be wasting opportunities at work because of alcohol. We could also be wasting our health, okay? Wasting our relationships. We are creating conflicts that we could have avoided, okay? We are increasing hospital visits because of alcoholism. Even if SHA is working, consider the time you use by making hospital visits. That's a lot of time. It could have been used to do something else that is constructive and helpful and that you can remember, okay? So let's save our jobs. Let's respect our work, okay? Let's reduce hospital visits and let's improve relationships. And we cannot improve relationships if we are not sober. Now let's go to another effect, and we'll be looking at alcohol and the brain. And maybe until this far, you may not have noted that alcohol has a very large implication on your brain. The brain is the most important organ, if I may say, in the body, because it supervises all the rest of the organs, okay? And here we have the area that is the quickest to be affected by alcohol. Once somebody drinks, this area of the brain, what do you call it? Those people who did biology, what do we call this area? Huh? Inaitwaje? Huh? It controls balance. Kuna kitu mnasema lakini hamtoi kabisa. Sisemi hii, nasema hii. It's called the cerebellum. Okay? It is responsible for your balance. Kwa hivyo unapoona mtu wa pombe anastaga, jua this area has been affected. Okay? So this is also the area that controls your fine movements. For example, when I move my finger like this, you know that is the cerebellum, the fine movements, okay? And then we have this area, okay? Here, it's called the temporal lobe. Now, everything you hear, you will not understand what I'm saying until you synthesize that information. And that information is synthesized in this area. Now, to be able to synthesize information or to understand what I'm saying, because what you hear is sound. You first hear the sound. So sound is meaningless until you understand it. So this is the area that is involved with understanding. Now, why do alcoholic people have confusion? Hallucinations. You saw the clip. They have hallucinations, they see lions coming, it is because of this area, okay? So if you disrupt the communication in this area, you don't understand. So this area is called wanike. Wanike. And if you lose cells in this area, you have a condition that is more or less similar to when there was in. Okay? You also have dementia, because this area is also responsible for memory. So you lose your memory. Okay? So you have confusion. And this confusion also translates to finding direction. You lose direction. Na ukisikia mtu ameitana upande huu, unaangalia upande huu. Okay? So there is no coordination. So. Ukisikia risasi zinapigwa upande huu, unasikia ni kama nini? Unasikia ni kama risasi imepigwa na husikii ni kama ni risasi. Unasikia ni kama mtu amegongesha kitu. Okay? So you lose ability even to define the sound and the seriousness associated with that sound. So unaweza ona mtu wa pombe, mapolisi wanapiga risasi kule na anaelekea huko. You see now how unsafe you become. You cannot judge you cannot define your environment properly because of alcoholism. So this is called the wanike area. Now we have your personality here. This is the area that defines you. Mtu, wewe, utu. Okay? Behavior. Okay? Judgment. Decisions, right decisions. To differentiate between right or right or wrong, it's this area. So unapoona mtu wa pombe amesikia kwenda haja na anasimama tu mahali kuko na watu, hii inakwambiaje? This area has been affected. So the brain is very important. We need to guard it. And the other thing I need to say, this is a full brain. A full brain does not have spaces in between. So you see these small lines here? Okay? Okay? But if you're used to taking alcohol, these spaces become wider. And when they become wider, your brain shrinks. It becomes small. And if your brain is small, then that simply means in terms of intelligence, decision making, you become so poor, and even memory. Okay? So let's visit some of the problems that come with taking alcohol. And the first one is vision problems. Hata mkizima mataa, tutaendelea kufanya nini? Tutaendelea kunywa. Okay? So they have very poor vision. And I'm only imagining if an alcoholic was crossing the road, how they can misjudge even the distance. So they can see a vehicle coming over there at very high speed, and they still insist on crossing the road because they have misjudged the distance. So hiyo mambo ya kuambia nitakuwa nimepita kabla gari ikuje, anakuja anafanya nini? Okay. And then we also have something we call ataxia. This is poor muscle coordination and steady gait. Ataxia, si unaona hii? Sijui kama unaenda mbele ama unaenda nyuma. Okay? Or you think they are pretending. When alcoholics are going like this, do you think they are pretending? They are not. I have shown you an area of the brain that is affected and is responsible for balance. Look at something else, fatigue or lethargy. They do not have the energy even to run. Okay? So they are in a state of what we call lethargy or fatigue. Kwa hivyo mtu wa pombe kile amebakishiwa ni mdomo tu, na anaweza tukana watu. Anaweza, unajua mimi naweza piga nyote. Naweza piga. Alafu ukimweka slap kinaanguka huko. Okay, hakina nguvu. Sawa. Because of that lethargy. Then we have disorientation and delirium. They are confused about time, place, and people. So ukimuuliza ni saa ngapi, mtu wa pombe atajua. They are disoriented. Okay, they have lost ability to determine time, okay, place where they are, and people. So mtu wa pombe anaweza kuwa amefungua macho na masikio anasikia, lakini hatafika nyumbani. Why? They know where the home is. They have the eyes. They also have the ears, and it is daytime na hatafika nyumbani. Kwa nini? They are not aware of space. They have lost ability to define where they are in space. Okay? Tuko pamoja? There are birds that come to Africa from Europe. Okay? They have what we call homing instinct. Ndege akitoka Urusi na kuna flamingos ambao wakati flamingos ni wengi Lake Nakuru, wengine wametoka mbali sana kule Europa. So, na watarudi, by the way. Watafanya nini? Watarudi. So the question is, how do those birds find their way home? And at the same time next year, they'll be coming to Lake Nakuru National Park. And they'll go back. How do they find their way home? Kule kuna njia, kule juu. So how do they find their way? It's called the homing instinct. Okay? And it's something to do with their ears, where we have the balance inside, and their brain, the area I was showing you. Okay? So they are able to define where they are in space. Okay? By assessing changes in the tension of the atmosphere. Okay? So even without a flight path, they're able to find their way home. And for human beings, we are supposed to be like that. In fact, usiku, mtu ambaye ni sober, when you are coming close to an object, si lazima uone, you're supposed to feel. Sasa, you are supposed to feel objects ahead of you. Na wakati mwingine, your feet, isipokuwa ni kwa viatu, your feet are supposed to sense vibrations of something in the distance. Na in fact, tungetumia masikio tukiwa wadogo, tulikuwa tunaweka masikio kwa ground, na we could hear vibration very far away. Hata gari ikitembea ina move ikiwa mbali. So those senses are still there. But you see, by taking alcohol, you can mask them. Na upoteze the ability to do what? To define space. Now, this is what I was telling you about. It's called Korsakoff syndrome. Severe memory loss. And I showed you that area of the brain between your ears. It's called the temporal lobe, where we have the Wernicke's area. Now, if you have severe memory loss, meaning you are losing both the memory of what has just happened, and you have lost the memory of the past. Mtu amekunywa pombe na umedelete everything you had learned. So alcoholism causes amnesia or memory loss. So it makes them hard to learn new things or recall past events. Kwanza mtu wa kutoa lock every morning, you can teach them new skills. So hata ukiona anafanya kazi vizuri sana, yeye ni carpenter na hakosei, ni kwa sababu hiyo ndio alikuwa anajua. If you attempt to teach them new skills, watakuwa na shida sana. So what does that mean? You know, life is dynamic. You have to learn new things daily. Lakini umetumia pombe, you will not be able to learn new things. So meaning you cannot develop. You become stagnated. So watu wengine wataenda wasome, wapate promotion, wewe ukae stagnated for the same job group. Ama uone bosi wako hakuongezei kazi. Okay? When it comes to sending people to represent the company elsewhere, wanapata hizi allowances, per diems, wewe unabaki kwa company, housekeeper, unaangalia tu huko. So your boss does not trust you with advancing the company. Okay? Being sent to gather information on behalf of the company so that you can come and re-educate the other workers. Wewe tu ni mtu wa kukaa huko, na watu wakija wanakuona all the time, wanakuona wewe ndiye wewe unaacho, na unajiuliza ni kwa nini? Si ni pombe? Sawa. Then there's something we call confabulation, which is inventing stories to fill memory gaps. Watu wa pombe wanajua ya kwamba they have a memory problem. So what do? They make up stories that are not real. Utasikia mtu anasema, unajua mimi najuana na mtu fulani. Ukitaka nikusaidie, ongea vizuri. Na yule mtu anasema anajuana na yeye. Ama anakuambia kwamba and I don't know why watu wa pombe wanajigamba ati unaona hii kampuni nilikuwa nimeajiriwa huko, na wakati huo hata hiyo gate hajaingia ndani, nilikuwa nimeajiriwa huko na tulikuwa tunajuana na huyu boss sana. In fact mshahara wangu siku hizo ulikuwa nilikuwa na mshahara hata karibu ninunue gari. Confabulation, because they know they have gaps in memories, therefore they can only make up stories. Okay, na nyinyi mnajua which are the other stories you make up? Watu ambao wamekuwa na challenge, is it true you make up things that are not there? Ni kweli ama mnawekelewa Okay, hallucinations, what are hallucinations? Yeah, things that are not there. Okay, unaweza sikia vitu vikikuguzaguza kwa ngozi unasema ati kuna vitu vinatambaa kwa ngozi na hakuna. Ama unasema nimeona vitu. Kwanza kuna one of the cases we were handling, a jamaa alikuwa amezoea nini? Alikuwa amezoea masturbation pia apart from alcoholism. So ametoka tu kulala, ametukuta hapo nje, anatuambia nyinyi niliwaambia mkitaka tukosane hebu endeleeni na hiyo tabia mnanifanyia. Ni nini hiyo mlikuwa mnanifanyia? So tunamuuliza ni nini tumekufanyia? Hii kuniingilia nyuma, mbona mlikuwa mnafanya hivi? Basi angalia tumevalia suti, sisi ni watu wa kufanya hivyo ba? Hapana, ni nyinyi. Nimeonyeshwa ni nyinyi. Sawa. Hallucinations, emotional personality changes, and I've talked of the area responsible for. Now, the problem with alcoholism, you remember? The B1 deficiency in alcoholism. Okay? So, those people who are taking a lot of alcohol, you are depleting or making yourself deficient in B1. So what happens? It causes you to have confusion, hallucinations, it causes you to have, and by the way, once you have this deficiency, you are losing your brain. Now, the other thing you're going to lose is your heart. Because B1 deficiency will cause damage to your brain, number one. And number two, it will cause damage to your brain. Then disorientation, poor focus, unsteady gait, and vision problems. We've talked about those. Yes. Yes. Uh-huh.
Is it a problem with those who are active in addiction? Or those who are, is it a withdrawal symptom of those who are trying to stop?
Now, it is both. It is both. What we know, the effect of the drug is still in the brain. Whether you are actively using it or whether you have stopped it and we have the remnants of the drug in you. So until we have done a very complete detoxification, that is when those symptoms will clear. Okay? So we have encountered patients who are complaining of or alleging to have hallucinations when they are still actively using the drug. We've also seen those who are having hallucination after they have stopped the drug. So it's both ways. But that can tell us that the effect of the drug you're abusing is still inside you. Okay. So they also have trouble understanding information or putting words in order. They don't have consistency. So they'll say one thing now and a different thing. Or they'll move away from the topic. So you cannot keep them in one line of thought. And this is the problem you find alcoholic people have with people who are sober. So mtu anasema ya kwamba huyu jamaa siwezi nikasikilizana naye. So they avoid you because you cannot maintain one line of thought. You cannot discuss something to its conclusion. But you still have confidence ya kwamba unaongea kitu ya maana. Na mtu ambaye ako sober ameona hamwezi muka. So those people who are sober will tell you, wacha tuongee haya mambo kesho pombe ikiisha. Because they are aware, they know you will never come to an agreement. And then we have impaired decision making. Huh? Oh, you wanted to pick something, eh? Okay, ni sawa basi. So I talked of confabulation, okay? Making up false stories, amnesia. We have anterograde amnesia. So they have difficulty forming new memories. And they have retrograde. They lose past memories. So what does that mean to somebody who is in school? If you're not able to form new memories, and maybe you have lost past memory, what does that tell you? If you're in school, how are you going to cope with exams? Huh? Poor grades. That is the truth. Or you have supplementaries. Now this would mean you are going to spend more time at school. And I've seen people, especially in medicine school. So there's a guy who joined I joined university in 2003. So there's a guy who has just completed medicine in 2021 after we joined in 2003. Okay? Because of alcohol. So how many years has he spent from 2003 to 2021? 18. Those are 18 years. Huh? So consider the money he has used, the time he has used, the energy, okay? And they are all lost. But we thank God, now he has recovered from alcoholism. Yeah, he is now a doctor in a public facility. So we can also redeem this time that we have lost. Can we move forward? Okay. So lastly, on the brain are the behavioral and emotional changes. Lack of interest in anything, so they lose motivation and interest. Okay. Then we have they are highly likely to become irritable or to get angry. Hao ndio watu ambao hasira inakuja haraka sana. Okay. And normally you do not want to interact with people whose anger threshold is too low. Too low simply means they can easily get angry. They also lack insight. That is why you ask them whether they are addicted, they deny it. So they do not have that self-actualization. Eh? So they do not even understand to what extent or damage they have because of alcoholism. Okay? So they lack insight, they are easily irritable, and they lack motivation. So these are some of the things that are going to affect your emotional health. And they might make having relationships with sober people be difficult. There was a hand there. Uliza, kuna swali?
The reason why you are able to form numbers. Excuse me. Can you be more than
not lack of apathy, but apathy. Apathy is lack of interest or motivation. So you get bored by anything apart from alcohol. So you don't have the energy to do anything. You only have the energy to take alcohol. And that's the problem. So we have increased incidences of anger, domestic violence, illicit sex. Because of the anger threshold being low, they have committed crimes, they have injured family members, including their own wives, including their parents and their siblings. We also have illicit sex. Wakati nilikuwa pale Madhari, a lady just came to me, 40 something years, okay, in the afternoon. And she could not face me while she was explaining her problem. Na aliniambia, in fact alitumia maneno, imefanyika. So nilikuwa nataka kuulizia, ni nini imefanyika? So anasema my son. My son. Nikamuuliza amefanya nini? Sitaki kuelezea zaidi, lakini imefanyika. Wewe unacheka? Do you know what it was? Rape. Rape? The son raped the man. Na si mbali, naweza kukwambia ni pale. Because of what? Drug abuse. Huyo jamani wa pombe na I think anatumia bangi. So what does that mean? I do not foresee a time when that mother will ever trust the son. And I don't see the possibility of them living together anymore. So we are talking of broken relationships or domestic violence or conflicts in the relationships. So drug abuse has resorted to serious social conflicts. Okay? So we've talked of destruction of the brain by alcohol. Let me ask you, if you are to move abroad and then you discover the pilot who is going to fly you is drunk, would you enter that plane? Would you enter that plane? Hapana. Bali hata kama ako soba, unajua hakuna kitu inakuanga na wasiwasi kama kuimagine ina plane ya kwamba hii kitu ikianguka ni hivyo. Na hiyo mawazo lazima ikujie kila mtu, especially ukiona imepita mahali na you know you have lost contact with their relatives. Hata communicate sasa hapa ni shida. And sometimes I imagine, I wish it were possible to write a text message. Mwambie mahali niko ni kubaya ama sawa. So the imagination that if anything happens, you can lose your life, okay, puts him into a state of anxiety and fear. It could be worse kujua ya kwamba the pilot is drunk. Mimi hata nikiona alikuwa naingia tu nikaona ameenda hivi kizunguzungu tu kidogo imemshika na si pombe. Hapana. I'll be very careful. Even to us what has happened. Okay? So, if you could be careful, and if you could not trust anybody to carry your life when they are drunk, that is the same reason why employers do not want to entrust people who are alcoholic with their jobs. That is why a mother would not like to entrust you to their daughter if you're alcoholic for marriage. That is why the guy in charge of the company, the manager, does not want to entrust you with the store key, with the keys for the store. That's all. That is why they do not want to entrust you with their vehicle. So, kama wanataka a driver, they have to insist to ask, and even ask other people whether you drink. So this suspicion is coming as a result of the injuries you can cause and the danger you can pose to other people because of abusing alcohol. So their worries and anxiety and fears are justified because they want to ensure safety. So the problem with alcohol is that you lose the judgment to decide between right and wrong. Okay? Now, did you know that alcoholism also suppresses your immunity? Our immunity is based in the bone marrow. The cells that your body generates to fight infections, they are all made in the bone marrow. And alcohol destroys these cells. So you become prone to infections and many other diseases. Okay? So you cannot compete in an environment that is making people sick. Your immune system will be weakened, and some have died because of a weakened immune system. Okay? And we still have many more illnesses. Okay? I talked of vitamins and mineral deficiencies, especially B1 deficiency, that brings the beriberi disease. Okay? You lose the brain, you also lose the heart. Okay? Now weight gain. Unajua vitambi vingi ni vya pombe. Unajua hivyo? Na ukitengeneza kitambi, because alcohol deposits fat under the skin and in the liver. And I showed you that. So the moment you deposit fat here, you're more likely to have heart diseases and also diabetes. So the best way to lose weight is to do what? Alcohol also predisposes you to cancer. You say alcohol is carcinogenic. Right. Okay? So you only need to take how many drinks in a week? 3 drinks in a week, and predispose your body to cancer. So if you're waiting to be a daily drinker to get cancer, even moderate drinking, at least 3 drinks in a week will predispose you to cancer. What do you think of alcohol and pregnancy? Some couples have given birth or have brought forth babies who have a hole in the heart because of alcoholism. There's a condition we call fetal alcohol syndrome, where the baby you give birth to or the baby you bring forth is mentally retarded. Unaona mtoto haelewi. Wengine wanasoma wanaelewa, lakini mtoto wako haelewi. So simu kila wakati mwalimu anakupigia simu, kuja uniambie huyu mtoto mnampatia stress nyumbani. Sijui, yani mwalimu anafikiria mnateza mtoto, kumbe ni mtoto wa mtu wa pombe, haelewi. And this problem came from the pregnancy. because either the mother was using alcohol or pregnant, or the quality of the sperms was compromised by alcoholism. So that is what we call mental retardation. By the way, ungependa kuwa na mtoto ambaye kwa class ndiye anakuwa mwisho? Ungependa? But you know, alcoholism can cause that. Okay? Kila mtu angejivunia mtoto ambaye ni chapcha, anaelewa mambo haraka. Sasa. So to avoid that, we also need to do what? I also told you that alcohol destroys the heart. Now, the only health benefit of alcohol is this: wanting to drink more and more. Okay? There are no benefits. Now, I want to send a caveat. Beware. Kuna watu wanatetea pombe kwa kutumia fungu fulani kwa Biblia. Akisema sijui nani aliambiwa atumie pombe kidogo kwa sababu ya tu. Who was that? That Paul instructed Timothy to use what? So swali ni, ilikuwa Tusker ama ilikuwa grape juice? It was grape juice, okay? Ama ilikuwa ile cake? Hapana. Sasa. So there's a difference between wine and grape juice. If grape juice ferments, it becomes wine. But the wine used today is not fermented grape juice. It's alcohol. Okay? It is alcohol. Okay? Whatever they call red wine, it is not fermented grape juice. Wine in the Bible referred to fermented grape juice. Okay? And what we call unfermented wine was grape juice. So ukisema ati Yesu Kristo alibariki maji ikawa nini? Maji haikuwa Tusker, pana. Ilikuwa nini? He converted water into wine, to grape juice, wine. Okay? So Jesus did not bless any of those beers we have today. In fact, the ones that are made today are made of chemicals, and some of which are very toxic. So you can't use the Bible to justify what? Alcohol causes hypertension and increased risk of stroke, and it starts with a beer every other day, and you end up having very many diseases. We've talked of broken relationships. It is not true that alcohol can improve relationships. Maybe it can improve relationships if both spouses drink, but there will be problem about wastage of finances, time, and money. Now, there's some Bible verses here. Ask and you will receive. Anybody who wants to come out of this addiction can find ready help. Okay? Do you believe in Jesus? Do you? Or you are atheists? So for those who believe in Jesus, we always have hope in the following, that whoever comes to Jesus, he will not drive you away. Okay? And you know, people may say that being a Christian is a burden, but I'll tell you one thing. Now, is being alcoholic not a burden? I think, it's a more huge burden. Okay? In fact, losing orientation, wasting money, wasting time, I would prefer wasting time with Christ rather than with alcohol. Okay? So we are told also in Proverbs 20, verse 1, that wine is a mocker, strong drink is raging, and whosoever is deceived by these is not wise. So Solomon was the wisest person, and he knew that alcohol can deceive you. And surely it does. It will trick you into committing crimes, into wasting your money, wasting your time, wasting your energy. Okay? You can take your money to somebody else and leave your family suffering at home. That is how it deceives. Huh? Yeah. So the people who you are supposed to invest in so that they can support you in future, you abandon them and you go invest your money into somebody who will never and will never recognize you. In fact, they are looking for an opportunity to rip you off and then go. Okay? So wine is a mocker. And we've come to the end of that presentation. Is there any question? Any question or addition? Yes, pale nyuma, uliza.